transfers in the radial nerve palsy. What are the deformities in radial palsy? They are the wrist drop, the finger drop, and the thumb drop. Now our aim in the tendon transfer for radial palsy is to give the patient a palmar grasp in order to lift something or hold something with their hands. So in order to give a grasp, we need to have firstly the extension of the fingers and the wrist, thus correcting the finger drop and wrist drop, and abduction, abduction of the thumb. Now before moving to the transfer types, we have to follow the general principles of tendon transfer, which we will discuss in some later videos. Now the standard transfer that we do in radial nerve palsy is the modified Jones transfer. Okay, so like just we discussed, what are the functions we want to give to the patient? Firstly, abduction at the thumb through APL, obvious choice. Secondly, the extension at the fingers. We are preferring ECRB here. Why? Because it is more centrally placed than the ECRL, so we are not favoring the longest tendon here. Then we have to give extension at the fingers also, which is through EDC, obviously. So what are the tendons that we are going to sacrifice from the flexor compartment in order to give these functions to the hand? They are, firstly, the palmaris longus will be transferred in place for APL, the abductor pollicis longus. Secondly, ECRB will be given by the pronator teres muscle, and the extensor digitorum communis will be given by the flexor carpi radialis. Another question that is asked in this step is that why are we favoring the FCR and not the FCU? That is because FCU is more stronger wrist flexor, so we are not sacrificing the FCU. We are instead sacrificing the FCR. Now a little mnemonic for you guys to remember this transfer. It is a very simple mnemonic. The first transfer is very simple. It is PL, meaning thereby palmaris longus in place for APL. Okay, so first is PL. Second, it is the mnemonic goes by TB, red. TB means pronator teres for extensor carpi radialis brevis. Okay, PT for ECRB. Now the third one is your red. Red means your FCR is for EDC. FCR is for EDC. Okay, and this combination is also easy to learn because in TB, when we give rifampicin to the patient, the urine turns orangish red, or we can remember it by red. Okay, so the mnemonic is firstly PL, then TB, and then red. Second type of transfer that we should always know in this radial nerve palsy is that Boyce transfer. Why? Because in about 15% of the patients, the PL is absent, palmaris longus is absent. Now what is different in this case? In this case, your one transfer remains the same, which is the TB, which is the pronator teres for ECRB, but this FCR changes. Here FCR is going for abduction of the thumb, going for APL, and for EDC we are using the flexor digitorum superficialis third slip. Okay, some books also mention that FDS fourth slip is also used to supplement the other tendons of the thumb, which are the EPL. Okay, so that is all. I hope this video helped you. Thank you.